Eleanor is a 64-year-old female who came into her doctor for fatigue, shortness of breath, and trouble staying asleep. She is a petite woman who has always been active. She enjoys shopping for her grandkids, playing golf, going for walks with friends, and teaching swimming at the local Red Cross. She complains that lately she has been too tired to do her usual activities, but she had attributed it to her waking frequently at night, which started a year ago and has gradually progressed. It really began to bother her when she could not golf or walk with her friends, or take her grandchildren to the park without having to stop frequently to catch her breath. Upon examination, the doctor refers Eleanor to a cardiac specialist and sets her up an appointment for the next day. The cardiac specialist reviews her blood work and explains that when her BUN is high, it indicates that the heart is working harder than it should be, and performs an EKG and an echocardiogram to find out more. After reviewing all of the results, the cardiologist diagnoses Eleanor with stage 3 congestive heart failure. The cardiologist admits Eleanor to observe her reactions to the new medications he wants to prescribe to help her with her condition. Eleanor is distraught and doesn't understand how this could happen to her. She tells him that she exercises and she doesn't eat all of that junk food like other people. Upon further questioning, he suspects that it is related to valve damage from rheumatic fever as a child. She is still upset and concerned about how her life is going to change with this new information. The doctor assures her that these are things they can help her address before she is discharged from the hospital. Eleanor's primary diagnosis is congestive heart failure. She came in with symptoms and signs of fatigue, dyspnea, edema, and waking frequently at night. The doctor performed an EKG and an echocardiogram. Blood work included a BUN that was elevated, albumin, hematocrit and hemoglobin, white blood cell count, sed rate, and a platelet count. Eleanor's at-home medicines include a multivitamin and calcium with D3. The doctor also put her on Lasix and potassium, as well as Norvasc to keep her blood pressure down. He also started her on heparin to begin thinning her blood, and will be sending her home on Coumadin. Upon examination, crackles were heard bilaterally in Eleanor's lower lobes of her lungs. The doctor suspects that her frequent childhood fevers played a part in her heart failure. One nursing diagnosis for Eleanor is impaired gas exchange. Nursing interventions include auscultating her lungs and monitoring her O2 sats. A secondary nursing diagnosis is decreased cardiac output. These nursing interventions include weighing the patient daily to monitor for changes in weight and monitoring capillary refill. Eleanor has a feeling of powerlessness due to her new diagnosis. Nursing interventions include putting her in control of her activities of daily living and assessing and teaching her knowledge of the disease process she's been diagnosed with. Eleanor also has excess fluid volume, as evidenced by her edema. Nursing interventions for this include administering her Lasix at 8 o'clock, as prescribed, and monitoring her edema every 4 hours. After a short hospital stay to evaluate the effectiveness of her medications, Eleanor is able to return to many of her previous activities. She now understands how to balance her activity with rest periods to allow her to enjoy the things that she has in the past. She has also set up regular visits with her doctor to monitor her condition, and was so grateful to the nursing staff who helped her understand how to take control of her disease instead of laying back and letting the disease take control of her.